How often do you get them?
Every 6 months. Like the same time every year I get it. Just around the same. I started getting it earlier. I think it's like more of a back to school thing when you're on the table.
That means I need to look that up. So,
But I always get
What are you trying to say?
Sudafed.
around a lot.
it's one of those weird ones. Do you have any throat issues? Do you still have your tonsils? When was your tonsils taken out?
I'll say 2006. I don't know if I have my adenoids or not. I can't really see the adenoids, so
Yeah.
we're not gonna know.
Oh, can we look?
But more than likely,
What was the rationale for your tonsils being taken out?
I got sick all the time. Like strep throat and all that good stuff.
Can't spell right now.
Your tongue down. Yep, yeah, he got it. I don't remember who that was.
You can see him.
Mine are ginormous to like golf balls.
Let me see.
Oh,
See mine.
recording.
Oh.
You all have your turn, I'm sure, working on my mouth. I mean, I'll have my turn working on your mouth. You have yours? And they're not inflamed. When they're inflamed, they're ridiculous. Wait, so she's got wrong one. Wrong thing. She's got a soft palate. She got a soft palate right here. There's a uvula hanging in the middle. Tonsils will sit right behind that soft palate on the sides.
And the palatine folds. Because those are palatine tonsils. You have a lingual tonsil on the back of your tongue, and then your adenoids is somewhere where your uvula up there.
When they're in surgery, they take the adenoids. They have to use a clamp. I don't know how you can see. And clamp it so they can pull that soft palate in.
Yeah, that's what my child's ENT was explaining, because he might have to have his adenoids.
Oh, you still have the little things on the side.
Is it those are it?
You still recording? Okay.
Oh yeah, did you not
Okay.
want to record anymore?
Yeah, you're fine. Okay. Have you ever been diagnosed with having seizures or being epileptic? Have you been diagnosed with bipolar disorder or schizophrenia or?
No, thank goodness.
Have you ever experienced depression or anxiety other than?
I mean, yeah, anxiety, but I've never been like diagnosed with anxiety. I don't have one.
So what if they were to say like, yeah, I've been diagnosed with depression?
There's follow-up questions.
Oh, she's just getting a picture of her tonsils.
Oh, I thought it was my
What causes your anxiety again?
just like tough situations that I'm in.
So stressful.
Stress.
Anything else? Because some people may say they're anxious because they're in a dental chair. That's something.
Don't people just get anxious sometimes? It's just a normal.
Yeah, but it's good to know what they're anxious about, because that may be where the dental fear comes out.
Okay.
So, good question. If you do, to answer your question, if you do yes, you can click which one. If there's another nervous system problem, Parkinson's disease could fall under the other nervous system problem is Parkinson's disease. Don't forget Michael J. Fox.
Yes.
So, if you do this one, psychological disorder, the follow-up questions would be, if they do have bipolar, let's say they have bipolar, I'm just going to put it in.
Bipolar.
Disorder. Those are the individuals that they get if they're not under control with medication, can go from one extreme and then get depressed. And they're kind of, yeah. So you can ask, how do you control that if they're on medications? under physician treatment.
So bipolar isn't when they're like really nice and then they're really mean.
Yeah, it can be. Yeah, it's a change in their mood.
Yeah. Like it's
They
just
can
like
be
a
manic and then depressive. Yeah.
It's like on off switch.
So it's not just one particular thing though. It's just like, oh, I'm gonna be really nice now, and then I'm gonna be
Then it's
really
like-
angry
Yeah, I have a
or
friend
like
who's
really
I have a
happy.
friend who's bipolar. I can tell when that person's not on their meds.
Oh,
It affects their decision making, their personality, the way they interact with others. They might be like, and then
Just all of a sudden, you know.
out of nowhere.
it's a struggle for them, and it's a struggle for the relationship as well.
And a lot there are with bipolar disorder. There's people that they think they do better without the medication, and they don't. They don't.
That's why it's a psychological disorder.
Schizophrenia is more they can hear voices, paranoia. They think there's someone there. They're not knowing if that's real or not. There was a movie. What was the name of that movie with Russell Crowe in it?
Was a really genius. Yes, he's a genius. Beautiful mind.
Beautiful Mind. A Beautiful Mind. That is a prime example. Have you ever seen that movie, A Beautiful Mind?
Yep.
That is a true story about a Nobel Prize person that struggled with schizophrenia, and he didn't want to take his medication because his vision and his creativity was
I'm gonna take it away.
was
That
taken
reminds
away.
me of like that one film movie. I guess it's not schizophrenia, but like that's fine. I don't think it's the same. I don't think it's the same thing.
I mean, yes, I have a friend who's bipolar. I have a friend that's schizophrenic. My friend who's schizophrenic, she runs, she swims, she knows what situations to put herself in. She just got on Facebook a few years ago. She won't talk to anybody over the phone because she doesn't know who is real or not, but she can correspond and stuff on Facebook and be fine. She knows what situation. She doesn't get herself in a crowd. She will go to the YMCA to swim, but she knows not to go into crowded situations. She knows what her limits are. So she is under medication, and she always goes frequently to the doctor because sometimes they need to be elevated or adjusted or whatever. So you always ask. Anytime they say yes to something, ask what they've been done, when they've been diagnosed, how they're being treated. You see the scenario going on here, okay? Depression. Some people can be under depression and take depression medication. My mom went on depression medication after my dad died and was on it, and it had anxiety too. So some of the medication does a dual job. So, because with my mom, she had depression and found out there was like 5 different levels of how they go through things. And I was like, yeah, I saw every single one of them during my teenage years. So, it's like, who's the teenager here? Skin diseases. Exactly. Acne.
Vitiligo?
How's that being treated? When was that diagnosed? See how I'm going here.
I do have a question. I have like
This
these
is gonna be really wiggly, you guys. I'm sorry, but I think
Let me
Oh,
get this
okay.
done.
very beneficial.
Autoimmune diseases. What's an autoimmune disease? Lupus,
HIV.
rheumatoid arthritis, HIV, Hashimoto's.
Sjogren's, myasthenia gravis.
So just be knowledgeable about what immune diseases are out there so you can ask. Okay. So let's say they have HIV. It's going to ask for a CD4 count and their absolute neutrophil count, which is ANC, and a viral load. And they should have a lab here for you to look at. Is the CD4 count below 200 or the ANC less than 500? You click yes. You know, it's going to be in red because that's an alert. Okay. Probably need a medical consult.
Right.
Okay. Ask the patient, have you ever been treated for any cancer? Had any chemotherapy, radiation treatments? If they say yes, what type of cancer? When was it? When were they diagnosed with it? What type it was? What stage are they in? What status are they in? Are they currently going under chemotherapy, or was it? How long ago was it? Those type of follow-up questions. I'm trying to speed up so we got some time to practice.
Well, no, I want to hear each scenario
me
that goes
too.
with each. Honestly.
We're almost done. Thank goodness. Artificial joints. When you think artificial joints, what do you think of?
A hip.
A hip, a knee, elbows,
Is it prosthetic count?
prosthetic, prosthetic, anything with pins, whatever.
So even if they have like a pin in their arm, that's a hip.
That's an artificial joint.
It's not a hip.
Artificial joint.
So like say they
Where's your
broke-
joints?
What if it's not in their joint? What if it's just like in their
Wrist.
no, because I know.
has them in here.
Yeah,
She has pins in her forearms.
my dad's pin.
From breaking their arm or something.
Yeah, it was
That's
like,
important to know.
it was so
Anything
bad.
that's artificial in their body, ask them. Is this important to know? What is it replaced with? Is it replaced with some other part of their body, or is it an actual metal
Also,
pin,
even
or
if they
is
have like
it?
a cadaver bone
Yeah, because
in
I
there.
have cadavers. I've got 2 cadavers in my knees.
Yeah,
So
because
that's
some people may say when you ask the question, do you have any artificial thing? They may say, yeah, but it's real stuff. It's cadaver stuff.
So they
may
would-
not understand the lingo.
Oh,
So you do.
artificial just means it's not
It's a
Or
replacement
a
part.
replacement
Okay.
would be good.
Right.
got it.
It's not
I
your
didn't
body
know
stuff.
that. I didn't know that.
Yeah. It's like pins and stuff like that. It's sort of like if you look. My mom had a plate and pins in her ankle. She had plates and pins in her wrist. She had a hip with pins and stuff in it. You get older, it's not good. You fall.
Superhuman.
Whenever she would go to the airport.
She never went to the airport when she got older. But she had a card. They get cards. So, you say yes. Let's see what comes up. Specify the joint replacement. Let's say it was me. Has the same joint been replaced more than once?
Yes.
Does the patient have comorbidities?
What does that mean?
What does morbidity mean?
They have multiple deaths.
If you want to, there's a question mark button,
Okay. Yeah, that's helpful.
which that was helpful. Includes diabetes, rheumatoid arthritis, lupus, HIV, septicemia, malignancy, or any autoimmune disease requiring immunosuppression medication. That's what it means. So if they don't, you can answer no. Luckily, they had that question mark there. I'm like, I didn't even know what they meant.
Oh,
Has the patient ever been pre-medicated due to joint replacement? Some people have. But they keep changing their rules and regulations. So. Has a medical consult been performed stating pre-medication is not recommended for this patient? No. So you probably have to do a medical consult. If that's the case. Okay? Environmental allergies. Do you have any allergies?
oh, I think I do, but I don't.
You think?
Yeah.
Do you have any? Are you allergic seasonal when when the seasons changes? Do you have any kind of allergic reaction? That's the kind of questions you would ask. If they do, how do you handle that? Do you take a medication or a calmant medication or something like that? Okay. Have you ever been told that you have a latex allergy? Have you had a latex allergy? If they do, you're going to ask them when they were diagnosed and what was their reaction. Okay. There's no latex in this blend. Just so you know. What other allergies are out there that's not medication? Pollen. That's seasonal. Foods. If they got a gluten-free allergy, they're gluten-free. They have to be gluten-free. Are they allergic to milk? Because there are some, what you're going to learn in oral health, there's a product called MI paste. That's not motivational interview paste. That's the MI paste, okay? And if the MI paste has a calcium type thing in there that's a milk product. You don't want to give it to somebody if they're allergic to dairy. So it's important to ask, are you allergic to dairy or stuff like that, okay? Seafood allergies, because you don't know what our products, some of our products may have stuff that's integrated and you don't know if that happens. Okay? If this, hopefully you'll know if it's female or male.
Red dye, like red
Hopefully,
dye.
there's.
So if it's
Yeah.
a yes, you're going to have some other questions pop up for a female.
Oh, yes.
Oh yeah.
Have you ever had any issues, gynecology, like when you go to GYN diagnosed? Have you had any children? Okay, if they say yes, what are you going to ask?
How many?
How many?
Were you
When
hospitalized?
when were they born? Were you hospitalized?
With their births
Were there
uneventful or
was there
Uneventful?
were there
Oh,
any
no problem.
adverse conditions that may have occurred from that? And then they say yes, especially depending on how big the baby was. Are you currently pregnant? You can't tell all the time, especially in the first trimester. And that's important to know because based on what we can do during each trimester. If you find out they just had a kid or something, ask them if they're breastfeeding. Hopefully they're not breastfeeding somebody off the street or something, but hopefully they're breastfeeding their own kid. But, you know, are they currently taking birth control?
I've friendly lactates and she's not nursing because
Right.
of her pituitary gland.
Right.
She donates her milk.
But are they currently breastfeeding? That's important because if you need to prescribe something, you don't want to prescribe something. Right. Exactly. Are they currently taking birth control pills? Why is that important? Because if you prescribe an antibiotic, you need to at least warn them that they need to do some other form of contraception during that time. Otherwise, you're going to end up like my classmate who got pregnant while in hygiene school.
Oh,
I was like, you know how that happens. She already had a child. She was married. She had a child. It was going to be twins. She lost one of them, but Imani's still alive and well and is a teenager now.
She was having twins in hygiene school.
Yeah, she was going to have twins. She lost one of them before full term.
Yeah.
Oh.
The other one survived, which is Imani. At UNC, we don't have a summer semester, so she found out that December before
And right in
went
May.
through the winter. So during the summer, she actually took what she needed for clinic, did her clinic time with the dental students, because at UNC, the dental hygiene faculty teach the dental students in the preventive recall area, which is preventive. So she got all her requirements for clinic for that following semester out.
And she passed.
And she passed. She graduated with me.
wow.
And we're still in touch. So,
That's good.
That's sweet.
Really cool.
So if you click on the allergies here, you also can get local anesthetic. Do you have any adverse reactions to local anesthetic? Something like that. There you go. Okay. Yes. There's a little pink thing here, so it gives you the warning. Have you had any other hospitalizations than what has been mentioned here?
Had my wisdom teeth out.
That's good.
I've been sitting there.
I think I'm supposed to was adult. I still have my teeth. You saw this.
When was this? Any complications? And you can keep forgetting about the Word document. Then you'll, based on the information you've gotten, you will determine if they're ASA 1, 2, 3.
Do you want to go over that just real briefly?
Normal healthy patient, they don't have,
Yeah.
okay. What do you think a mild systemic disease is?
Somebody with problems, but it's controlled. But it's
Yeah.
Like diabetes, that's controlled?
I think she's 2, because 3 is a little like if she
Yeah,
wasn't
what is
controlled.
3?
She wasn't.
3 is like if you have a severe compromised patient with a
Not
severe
for real.
systemic disease, someone with COPD, congestive heart failure, that puts them at a higher risk for something to happen.
So I think she's a 2.
That's it.
Oh yeah, she's
Oh, that's right. I forgot about that. So there you go.
3? It's been within 6
5 and a
months.
half months.
So shouldn't she be 4? We can't treat her today?
It's 4.
That's cool.
It has to be with this good cat.
What's his 6?
Oh, thank you.
There you go, Debbie.
I just automatically passed my medical history competency.
It's before 6 months, right?
It has to be more than 6 months. Yeah. So it'd be 4 to 5. Yeah. Something that's a constant threat to life. Heart attack. Yeah. Compromised. It'd be more like someone who's got.
So if she had a heart attack, but it was like 7 months ago, would she be a 3 instead of 4? That would be the difference.
Yep.
Okay.
That would be the difference.
Debbie, I think you might
Okay.
Oh my.
Looking through
She's
that.
No, we didn't.
Does the patient need to have anything at chairside? If you click on yes,
inhaler.
inhaler. Any other items needed at chairside?
A doctor. Heart attack. I
already
don't
say
even
inhaler?
Say they are a patient that has to have their walker or something like that.
Yeah.
That's
That's
something
a,
that's.
Oh, so that's what you read.
Oh, they're.
Oh, we were just like.
Oh, I didn't know that.
Yeah, I was like, I don't know.
So green means it's.
That's what they need at chairside. So you can go. Oh, we need to make sure they have that at chairside.
Oh, okay.
Medications, med allergies have been reviewed and are accurately documented in medication tabs and in ERX. ERX is what you can get to. So we can go no because we can't get to it. No changes to the current medical history at this time. This time you can just leave it unanswered because you're not reviewing the medical history right now. When you come back, this form will stay there and you may have the patient come back and you'll review it. And if there's any changes, you will note it here and then you click yes.
So
and
their
decide
second
again.
time they come.
Because you never know. Somebody might get sick and had strep throat and is on amoxicillin right now. So you want to make sure that's noted. Any other medical conditions? Yes. High cholesterol.
That's not fun.
Oh, why that heart attack keeps coming.
Oh, is that what we would put in there?
Yeah, diagnosed 20. Let's say diagnosed in 2000. Yeah, but you never know.
Yeah, you can be young and
Physical, do they have any physical disabilities? Like,
I was blind. Yeah.
maybe they were in a car accident and they limp.
Broke my leg. Oh, I didn't say that earlier. You really did? I was in a car accident.
And you will have patients go, oh yeah.
And then you just scroll up and change it.
Like, okay, let me add that
So
in.
make sure you write more detail up here. You can briefly do stuff and then doctor it up to be it coherent. But you want it here. And then you can go based on the conditions. Okay. They have high blood pressure. Medications. If they don't know, I have to call the pharmacy. I remember that. So then you put medication, which is the blood pressure med.
Now, what if pharmacy doesn't answer and they don't know?
They should,
They should answer.
unless you're dealing with the VA. Then.
But like, can you keep receipting or you just can't?
You can keep proceeding, but you may not be able to do any treatment until you find out if it's.
Receding.
Um,
What does she mean by that?
Like, finish out the rest of the medical history.
Oh, okay.
So we just can't actually work on them, right? Is that what you mean?
so you want that information in here. Contraindication effects.
Oh.
Okay, and that's how you do all of it. Dosage. Time of day. Okay. Once you've gone through all the conditions and specify what medications are for that. You want to ask them, are there any over-the-counter medications that you're currently taking? Any herbal supplements? You take a vitamin? They forget about that. So you have that information to look up. Other thing is to ask them when was their last physician's appointment. And so say their last physician's appointment was December 2014. Okay, what was it for? Could have been a sick visit. I had mono. Okay, you know, I'm just making up stuff.
What if it's like OBGYN? Is that
You can do that.
that one's a
Right.
visit?
When and then ask when was your last full physical. If there's been a sick visit, you want to ask them when was their last full physical. Okay. And it's important because if it's been 2014, 2016, or it's been 2010 and it's 2016, well, yeah, I don't know what's going on. You may not have a whole complete because there's nothing been done.
So did you say
Or if they don't,
Did you say medical?
no, not necessarily, but be on your
Toes.
toes. Those are the people that usually diagnosed with high blood pressure or diabetes.
Or diabetes, yeah.
So
So if they haven't been to the doctor in however long, we need to take their blood sugar or their.
It's like a
no, don't take their blood sugar, but watch them.
yeah.
That's when your medical emergency syndrome instincts kick in. Just be aware.
Keep your
You never-
eyes.
keep your eyes and ears open.
I need to stand up.
Okay.
Do you want to record for a while? My arm's about to
Based
fall
on
off.
that,
Not really,
if
but-
you ask them when their last physician's appointment is, make sure you go to the Rolodex. Make sure you go to the Rolodex. Make sure this is highlighted. Go to the check mark. Go to clinical. Go to the patient physician, and this is where you'll. Let's see if Jack Black's in there a lot of times on Chick-fil-A Lane. If they're already in, search for it, see if the physician's already in there. If it is, click on it. And click on it again so it'll be entered there. If the physician is not,
I'm shaky. I'm shaky.
Oh, and this goes really down.
go to create a new record. I'm a doctor now.
Hello. Good, how are you? Staying alive?
CPR.
Okay. Add their stuff in there. Go okay. Oh, I'm in there twice now. Then search for it. Okay. Double click. Oh, then add the plus sign. Sorry.
I see.
And
Then it's
save.
in there.
Oh.
So when you have a medical consult, the address and everything should pop up on the letter. Speaking of which, if you have a medical consult, and the medical consult criteria is in the in the clinic manual too. And when it says multiple medications for a medical consult, that means multiple medications for a certain condition, or medications that you all of a sudden discover may contraindicate, cancel each other out. Okay. Not just because they got 7 medications, 3 of them are vitamins, and the other one's for heart, one's for cholesterol, one's for diabetes. No. If they're taking 5 for the same high blood pressure, something's wrong. Okay? That's what it is. I have to explain that every year, so I want to make sure. Does the patient need assistance? Might. Out the door. Because of a heart attack. Okay. Then you click on this. It will tell you if there's questions not answered before you do that. You get their signature. You hit little add. Okay, have them sign. Click OK. And boom. Okay? Now, if you need a medical consult, stay on forms. They're right here. Scroll. Medical consult letter. Okay. Name the physician. Problems. High. No, high blood pressure is a different letter. High blood glucose. Reading was 400. Whew.
Alright.
Sometimes you have to explain it to the doctor. They don't always know our lingo. There's a whole letter that tells you what to do. I'm just putting it on that right now. Once you fill this out, make sure you go to consult, have them sign. First the patient signs. Okay. Okay. Then the student provider sign. Put your name in there. Susie Sunshine. Then you have the faculty sign.
Oh my gosh. Everybody sign in this form.
We're witnesses, that's why. Then go over to consult response. Is this an open consult? Meaning that you haven't gotten a response yet, so you need to click yes. When you do that, it will be up in this area to alert whoever's the next person that sees it. It says medical consult indicated. You notice right here. Until it comes back, and then you put whatever's in here that's needed and fill it out. Once you do that, then you click no, and that disappears.
So when the medical consult comes back, will it come back the email?
Fax.
Fax. And then someone, that could not, it may not happen, it's not gonna happen during the appointment, right? Okay, so they'll give that to us, and then we input the information?
Now, if you need a BP,